Morning, everybody. This morning, rather than going out for a training session, I'm having the morning off and I'll do it this afternoon. So the reason I'm here is I just wanted to look at COVID-19. This morning I get up and I'm bombarded by the COVID testing and I'm looking at the headlines. Somebody texted me a story of COVID-19 testing fiasco again. So I just wanted to share a little bit more about COVID-19 because I think it's ridiculous what's going on out there. And somebody in the government needs to get a grip of COVID-19 testing because it's just a farce, to be honest with you. And having worked in the industry, I've got my points of view, I've got my opinions, and I'm going to share some of the headlines I've looked at, and I'm going to go through the COVID-19 and just talk you through it and see where we are with everything, because some of the things the government is doing at the moment is wrong. It's a money spinner. I'm coming to the conclusion it is a money spinner, and I'm going to show why in the next 20 minutes, 30 minutes. So bear with me. I'm going to go through it. I'm going to share my screen. I hope you're all well this morning. All right. I'm going to share my screen and we'll go through some of the headlines I've been finding. So first one I wanted to share, all right, was right. If this is where I went when I had people who were nurses, or especially I had the ICU ward sister come to the site, and she weren't registered, and she'd been struggling to register all day. All right, and she had a disabled son with her, and it got me emotional at the time. I was in Chelsea, and we weren't allowed to take more than 60 people on this MTU mobile testing unit site, and there was only allocation of 60 tests, and she was one of 4 who come to the site. She'd been told by the doctor she needed to get a test for the son, and she just couldn't get a test. She couldn't get on. She tried for 2 days, I think it was, to get a test. So what I done, I went to this site, and it's www.nhs.gov to register your test. And as you see, all right, when you go there, if you're on site, a site manager can do this, because what they do, they go start now, and where you're taking your test, and you just put this app test at the site, and then you can continue. All right, you put the code. We used to put the postcode, so we knew the postcode of the test site, so we would put the postcode in. So let me think of a postcode that we used to use. SW10 0ND. I think this is one. No. So you put the test in there, the postcode for the test, and then it takes you to the test. You select the test, and there's a section in there that you can actually put in the actual barcode. You scan the barcode of your test, and then actually you go through and you register the barcode of your test where you're taking it on site. All right, and it does work. I've used it myself. I've tested people in. All right, so when people say, "Oh, the test system is fully booked," it's not, because I can get confirmation of bookings once I've actually scanned the barcode in. I can actually register people on the system. So when the government is saying, you can't get slots, why can't the government just go back to walking and use this system? Because it's much easier. All right, we have 400 tests on the MTU unit. If they're allocating only 60 tests, 120 tests to an MTU unit, they should actually be open and put it on the website. We've only got this many tests. So that's a big question I wanted to pose out there, because I have tested people in, or booked people in and tested them through this system. So yeah, here we go. Why? Another headline. why UK COVID testing must be more than just numbers game. All right, yeah, there seems to be a numbers game out there, because at this moment in time there's a lot of test units being set up. Local test units are being set up, as you can see here. Okay, New Bexley COVID Test Centre opens on Erith Road. They're opening them up everywhere, the local test centres, where you can just walk in, but you've got to register again. All right. So we're opening up all these new test centres across the UK. However, the labs are struggling, they're saying, to take the tests, and people are struggling to get the test results back. So, questions have got to be asked. Why are we opening so many test sites up when the labs are struggling? So the right hand doesn't seem to know what the left hand's doing. So that's my one big concern we've got going on there. All right. And especially when you look at some of the other headlines, people were booked in for coronavirus tests at a centre in the Rhondda Valley down in Wales, despite it being closed. This is no surprise, all right, because I have turned up to a site with an MTU unit in Hammersmith and Fulham, and we turned up on the site, and when you turn up, you get details of your representative, the person you've got to contact in the council. I actually turned up the one morning, and I phoned up the council representative. They were unaware of us being there. When I spoke to one of the head people in the council, who was an absolutely amazing guy, and I said, look, I've just turned up on site with an MTU unit. I've got 9 MSOs with me and my supervisor. Where would you like us to set up? And his response was, Clive, I haven't booked an MTU unit to go to that site today. I haven't had permission for you to set up in that area at the moment, because it was a public car park area for a sports centre. So he had to go. He actually asked me, what happens now if, because we haven't told any members of the public that you're there to test. We need to do a campaign now, and if I can get permission for you to set up, can you set up? I said, yeah, I'm here for you all day. So I'm here from 10:30 to 3:30 for you. So this was about 9:30, 10 o'clock, and he got us permission. However, he said, what happens if I don't get you permission? And I said, well, we just go back to the regional test area in Heathrow, and we actually, I'll knock the people off by about 10:30, because there'll be no strategic are already there. They've got people on standby, so my team will go back and we'll tidy the vans up, clean the vans, and we'll probably knock off. So luckily enough, on that morning, the representative of the council, who had booked us for the Friday, I think we went there on a Wednesday, he booked us for the Friday to be there, actually got us permission. But we tested, our figures were low. I believe we tested about 64 people that day. All right, we had 400 tests on the van. So, so that's no surprise there that people were booked in for coronavirus tests, but the site was closed. All right, I've had it before. So where people, and I know other MTU managers have turned up on the site and they weren't expected there. All right, so that's the type of things which are happening. So there's no surprise. It's in the media. It's again there. This is another thing which is really, I'm asking questions about. Heathrow private sector is now, Heathrow set up a COVID testing area for passengers. For when they come in, they can be tested for £150. As soon as they come in from another country. But my biggest question here is, why are we fleecing people of £150 when we've got an economy downturn? And we're asking people, to be COVID tested in Heathrow for £150 when there's a COVID test centre, and it's the biggest test centre in the UK, and it's around the corner. It's actually between Terminal 1 and 2. It's by the Hatton Cross Underground. So that's a regional test centre. For the last 3-4 weeks, it's only been doing 220 tests a day, and that test centre is a 10-lane test centre. It has actual self-testing, where you test yourself, and it has assisted testing, where somebody helps you test, or somebody tests you. So why are we allowing this to go private? And organisations are making, they've got to be making money, all right? And £150 a test. The question I would ask is why aren't we using the MTUs we've got to set up? And why aren't we using the facilities in Heathrow already? It's just more money being thrown away, you know. I can't get my head around it. What's going on really there? So that's a question I'd like to pose to everybody. And this is an absolute amazing one. All right. And if those of you do not or didn't hear about this, all right, this lady here from Scotland is an MP, and Margaret Ferrier, all right, SNP. She travelled down from Scotland, and I believe she went for a COVID-19 test. She travelled down to be in the House of Parliament to debate the COVID-19 bill. And while she was down in the Houses of Parliament, I believe her test come back as positive. Despite her test coming back positive, she travelled back up to Scotland on a train, all right, and she actually spoke in the House of Commons. So, House of Commons, I'd ask the question to the House of Commons: how many people have you got isolated from that day where this lady actually come to the House of Commons? She was actually tested positive for COVID-19, and yeah, she went to the House of Commons to work. So everybody potentially everybody in that House of Commons on that day, really, under track and trace rules, should be self-isolating. That's a massive question that needs to be asked, which is not being asked at this moment in time, I don't believe. I haven't seen anybody in the papers asking the question. So, track and trace. How did that happen? If track and trace is so good, like everybody makes out it is in the MPs, and Boris says we've got the best track and trace, how did an MP actually who tested positive attend work, even if you had symptoms? She went for a test. That tells me she went for a test, she had symptoms. So she should have been self-isolating. She shouldn't have actually been on the train coming down to London, whatever transport she'd taken to the Commons, all the people she came in contact with, all right, in the House of Commons. Then she left the House of Commons, got on a train again, went to Scotland. Well, what's really going on? We really need to hold the MPs to account, because at this moment in time, we can't hold the MPs to account because they bury their heads. And anything we ask them about today, and there's a lot of concerns out there, not just about COVID-19, about the anti-lockdown, all right? We've also got questions about mental health, the state of the economy, the way the veterans are being treated, community of veterans, CMS, CSA, how they are performing. So, you know, we've actually got suicides going on, people taking their lives because they're struggling with life struggles. and MPs ignore us. And I can tell you now firsthand, because I've wrote letters to MPs. I've actually wrote letters to Boris Johnson. I'm even waiting for a reply from my local MP, and I phoned the MP about an email I sent in my next borough, and they contacted my local MP. They said they would contact her and ask her to reply to one of my emails. So, MPs seem to be unaccountable and a law to themselves, as demonstrated here. So really, we need to ask questions. This COVID-19 is unbelievable. What's going on? And we need to stand down and look at it. We've even got reports that the UK market is flooded with inadequate COVID tests, experts suggest. These experts know what they're on about. They're probably the best in their field. All right. Lack of clear rules about certification standards may be allowing manufacturers to sell test based on poor and dodgy data. And this is a cracker, because this has brought something to my mind now. All right. Yeah, we've got British standards for all PPE, for all safety. Any products coming into the UK, we've got a British standards we need to work to, and they need to be manufactured to. So the questions have got to be, why are these standards? Yes, we have got an epidemic on, and we need the testing equipment ASAP, but we shouldn't be compromising health and safety, which is being done across the testing element. I tried to contact the HSE. I can't get in touch with the HSE because they haven't got an outline anymore. I've phoned a few numbers for the HSE, but I can't get through to inspectors. And a lot of inspectors I've known who know me, I can't even get to them at the moment. So, there's a lot of questions got to be asked. Why are we flaunting our health and safety standards? And over the last 2 days, I've heard that plastic straws, cotton buds, and anything really with plastic is not to be used in the UK. It's being banned in the UK. Question I've got now for those out there: cotton buds. What are swabs? Swabs are similar to cotton buds. If we're banning cotton buds, then where do swabs fit in with that? That's a question I'd like to pose, because, it's the cotton. If I'm not miscorrect, if I'm not incorrect, the swabs I've been using have been plastic. So what's the difference between the cotton bud and the actual swab we use to test? So, there's a few questions I'd love to sit down with an MP who is actually, or the experts who are running this COVID-19, because there's a lot of money we're spending setting up these units, and taxpayers are going to end up paying for this in the long run. All right, through mental health and financially. Trust me. Yeah, and this is a remark which was made in the Lancet Respiratory Medicine website. Absolutely brilliant for information. I've just took out an area where I'm going to read it to you. As many illnesses have symptoms that overlap with those of COVID-19, it is hard to distinguish the underlying causes. For example, symptoms indicative of influenza infection could be mistaken for COVID-19. All right. With the influenza season approaching, it is likely that anyone displaying these symptoms will require a test to rule out COVID-19. Additional guidance is needed from health officials to help educate the public on when it is appropriate to get tested. This is a major factor because everybody who comes to the testing site, they've all got some sort of symptoms and which overlap. And a lot of times we would stand there and talk to them and say, have they got a cough, persistent cough, temperature, rising temperature, and the loss of taste and smell. Loss of taste and smell was always a good one, because a lot of times people would come there and they said their child, or they only had a temperature for 24 hours earlier. They're better now, but they've been told because they've come away from their work area or the child's come out of school, they've now got to have a COVID test to show they're negative of COVID. It seems to be a big education thing. We need to go, like they say in this website here. All right, we have got the influenza infections rates go up this time of year, colds, there's a lot of symptoms which overlap, and the government should be doing a campaign on TV, and because that's just going to increase the testing. And don't forget, these tests, there's questions about these tests because it picks up if you've had the actual COVID virus, the tests that can be false negatives, all right, or it can pick up the dead particles of the virus, all right. They don't say you've got the virus now, so you've got to be very careful, and tests are going to go up, and there's going to be more demand for tests as we're seeing now, all right. So I'm just wanting to give you a flavour. There's a lot of things in this COVID-19 we need to be looking at. With all the test centres going up, with all the money we're spending, we're in an economy downturn. We're locking down everywhere across the country. Small businesses are being affected. A lot of small business were affected by the first lockdown. Entertainment industry. While I was working as an MTU manager on COVID-19, as an MTU manager, right, on Heathrow, majority of the people there in Heathrow from an entertainment background or from the airlines industry, and it's heartbreaking because they've got no certainty of their future. That's all they've got is uncertainty, because we may never go back to normal. What is normal? All right, and yeah, it is unbelievable. So there's another one I wanted. Yeah, this is one which is really close to my heart. All right, coronavirus. Major UK testing company broke health and safety laws at the height of the pandemic. Look, the breaches raise questions about the role played by gig economy workers in testing supply chain. Look, it still goes on. Health and safety is human behaviour. A lot of time we become complacent, all right, and health and safety laws are still being broken, all right. I can tell you that now. Now and again, procedures are either not being enforced or the corners are cut, all right, and yeah. Is something that in construction, health and safety is a major concern, and we have inspectors and advisors and safety officers who go around sites to see how the management are doing and how the teams are doing, and just to remind them and provide solutions if they've got problems. The COVID testing units, all right, well, up to the day. Up to yesterday, all right. Never had a health and safety. I never seen a health and safety representative checking, doing audits, doing visual inspections, checking the sites, checking if the teams were working correctly. And there was no committee meetings, or there was no way of really speaking to somebody and raising concerns. If you raise concerns, you'd only go through one department. Although you had a safeguard and you had the health and safety poster, at work poster, and you had names on it. All right, the contact number shown on the health and safety poster was missing one digit. So on the phone number, it went to the head of health and safety for the company, which referred me back to HR department. So I would have liked to seen some health and safety representative at least visiting the sites once a week and doing an audit, and speaking to the people, but it doesn't happen. So there is flaws there. The HSE, the HSE, there's no numbers to get hold of the HSE, Health and Safety Executive, to raise concerns, which I haven't found any. So there is questions got to be asked there, and I would actually think safety would be the most paramount issue with COVID-19 testing. All right, because the testers are not tested. The testers are not actually bubbled in bubbles. All right. Somebody made a comment yesterday on Question Time, which is absolutely brilliant. We've got kids going to school at the moment. Potentially the children are going into school. They're meeting other children. You could have a classroom with 27 kids. That's 27 families. And your child has been exposed to 27 other families. So your child comes home, and that's okay. But it's not okay for us to try and open up the economy. We can't have more than a set amount of people. We can't meet our family. There seems to be a lot of inconsistencies in COVID. The only thing I do know is for certain, COVID is lots of money being spent on COVID. Lots and lots of money. And taxpayers like myself, everybody watching this, you're all the people who are going to pay for this. And mental health anxiety is huge at the moment, and it's getting bigger and bigger, and we're setting up more test units across the country, and the laboratories are still struggling. So, and that's seen by the struggles people are getting of booking tests, turning up the test centres which are not there. Come on. The UK government need to get a grip of this. There's been people asking questions for quite a few months now. Boris, you need to start leading, because just your incompetency the other day asks questions whether you were just following the advisors. And we've got advisors in the UK, we've got experts in the UK torn. We've got one side saying we should be doing this, we've got the other side saying we should be doing this. So, let's get everybody around the table and actually see if we can come to the centre where we're not going to make everybody happy. Yeah, we understand that. But at least let's have some truth out there. Let's get to let's start seeing what we can bring together. Let's look at other nations as well, and stop trying to be the best, and stop trying to go, we'll vaccine everybody and we will become the world COVID lead. We're not leading anybody at the moment, all right, around the world. We ain't the best. So stop thinking that and get a grip, because at this moment we're a laughing stock. Our media, social media is wild of COVID-19 incompetences, things that shouldn't be happening. All right. And follow the money trail. That's the question. Follow the money trail. All right, because there's a hell of a lot of money going. How many people are suffering from other illnesses such as cancer who ain't getting the treatments? How many people are suffering who need operations? It's how many ICUs are really full out there. At the beginning of this COVID, we were, correct me if I'm wrong, we were registering majority of deaths in hospital as COVID related. What is the true figures we've got out there? And the last thing but not least, if you put rules in, don't go breaking the rules. The rules exist for everybody, not just a certain geographical area. It exists for Parliament. COVID doesn't select, oh, they're members of Parliament, I don't need to go near there. The House of Commons, I tell you what, COVID, we stay away from the House of Commons. All right, we don't go near them. Isolation. I'd like to see in the media a report that the MPs have isolated all the MPs which were potentially exposed to the COVID when the SNP MP come to work. All right, because you're asking everybody else to do it. So I would like to see something at least in the media to say, or Boris Johnson to come to the table and say, yes, this is what happened, and the House of Commons, the following MPs have been isolated. All right, that should have come out. We shouldn't even be asking for that. That should have come out straight away as soon as the news broke about the MP being positive. All right, and potentially she took a test. There's nothing else to say. She shouldn't have. She had symptoms. If she didn't have symptoms, she wouldn't have took the test. Okay, because if she took the test and she didn't have symptoms, then she's wasting the test. She's wasting a position for somebody else, which is what we're trying to stop. So she had symptoms. She shouldn't have even got on the train to come to London. She should have actually had her test and gone home and stayed in her home and isolated. Okay, so questions need to be asked, Boris. Sort it out, get a grip, because you are accountable as MPs to the people who elected you. All right, stop flaunting your positions by actually thinking you're above the law. All right, because you're not. This is disgusting what you're doing. So, and that's all I'm going to say today. Little rant over. All right, I love you all. Yeah, hopefully there's an investigation on my issue. All right, which at the end of the day, my services are no longer required. This is where I am now. I'm still got a bit of a confusion. I'm still feel discriminated and alienated by Sodexo. But I believe there is somebody investigating now, so I'll hold out on that. You know, look, I love the people I worked with. They were absolutely brilliant. And the job was good as well. But it was just certain areas were a little bit flawed, that's all. All right. And if the government done what they are supposed to do, then these test units would be absolutely brilliant. But it's the government. All right. And it's the people up above these contractors who are controlling and telling them where to go, what to do, all right, and how many tests they have. And councils, it's out of council's control as well. Okay, it goes right at the top, this does. So let's see what comes out. All right. Love you all. I'm going for a swim later. Remember, if you're struggling, reach out, get in touch with somebody and share where you are in life. All right. Ta-ra.